Hey, everybody, it's Natalie Benson-Vega, and welcome to another edition of Facts Over Fear. I have a really good show today. I mean, all of my shows I think are wonderful, but this one's really special because this involves the Midwife Center, which is a space that's very near and dear to my heart. Here in Pittsburgh, this organization has been quietly transforming maternal and infant health one family at a time since opening its doors in the early 80s, 1982. The Midwife Center has supported we're almost there to 10,000 birds. That's going to be really fun. We're going to talk a little bit about that. The Midwife Center has championed personalized relationship based care, helping to improve outcomes for parents and babies while expanding access to compassionate, evidence based midwifery services. Of course, the work goes beyond just birth. It's about empowerment, education, advocacy, and building healthier communities. And I think this is an important and very timely topic for this moment because how many attacks there have been on maternal health in the United States. And I think we need to recenter our conversation and remember the importance and impact that birthing people have on all of our lives. And so joining me today is Emily McGahey. She is the clinical director at the Midwife Center. Emily, thank you so much for being here.
Thank you so much for having me. I'm really excited to have this chat.
Oh, absolutely. I mean, I've been going to the Midwife Center just for my own care for years. I think what you all do there is so impactful and so important. But before we talk a little bit about the organization, I want to hear about your own journey. How did you find your way into this work?
Yeah, I was so lucky. I even in high school, I was ready to be a nurse. I knew I was going to be a nurse. I was just like that kind of nerdy kid. I just fell in love with it. And I went to undergrad and I got my, undergrad in nursing. And I really fell in love with women's healthcare during that time. And I just knew that was what was going to do. And I was very lucky that I got a job right out of college to be working on labor and delivery. And I worked in Colorado is where I'm from. And I worked on a labor and delivery unit with just incredible midwives. And I just saw how impactful the midwifery model of care could be for people, and the uniqueness and the caring and the education and the autonomy and partnership that these midwives formed with all of our clients. And they just really inspired me to be a
Mm.
midwife. And so then I was lucky enough to go back to school. And then I have been extremely lucky because I've been working at the Midwife Center for a little over 14 years. And since I graduated from midwifery school as a baby midwife, I have been able to practice my whole career at this wonderful place.
What separates midwifery from sort of like the traditional OBGYN in a hospital setting? Like
Yeah.
is it more of just vibes? What is
Yeah,
it for
it's such
people
a
that
great
makes
question.
them choose the
I think
difference?
even I always remind people is like, right, like our OBGYN colleagues are physicians, they're
Mhm.
surgeons, they do more high risk stuff. The midwifery model of care, which has been around forever, right? Like
Mhm,
women
mhm.
taking care of women through their life changing experiences. And we focus on wellness. So we really view all of these parts of our lives, right? Our first period, how we adjust to having periods, when we want to achieve pregnancy, how we don't want to achieve pregnancy, if that means contraception, and all the way through menopause. So that's what
Mhm.
midwives do. We walk you through those types of things, providing education, support, and helping you realize what's normal for you and how
Mhm.
you can thrive and that people can have that. And so it's just a difference between like an illness model and a wellness model. And we
Mhm.
really come from a wellness model, of sort of normal till proven different, and that, allowing the individual to be the expert in their care. And I'm really just there to provide the additional knowledge, support that I have given my education and experience.
Do you still remember what it was like being present at the first birth that you
Oh my
assisted
goodness.
in?
Yeah, I mean, I had a beautiful delivery this last week, and I said to the family, like, it just never gets old. For 20 years, that moment from when there wasn't a person to there is a new person, and watching this family be created and the moment that these folks get to have and experience, is just such a it's a very lucky world I get to live in, and it's a very I feel very grateful that I get to be chosen to be a part of this for so many families, and that I feel the same way for even just, like, in clinic, like, I'm grateful that people wanna come to us and talk to me about contraception and their wellness and, you know, and their perimenopause and all the things that we all talk about all the time, right? And so,
Yeah.
I think for me, it just is like, I really am just feel really grateful.
That's awesome. I really wanted to have this conversation because part of my work with what I do with Facts Over Fear is really trying to normalize things that perhaps
Mhm.
we don't always talk about in just a normal light, quote
Yeah.
unquote, and I think using words like perimenopause, like periods, and just having these conversations around birth and acknowledging that these are things that we all experience or that
Mhm.
a lot of us experience. It's important because it connects us. And
Yeah.
I think as we've seen sort of the rise of the corporatization model of healthcare, we're sort of seeing that sense of disconnection, right? There's
Mhm.
a lot of people that don't have access to even preventative care or the
Yep.
or the wellness model of care that you're
Mhm.
talking about. Most people don't even really have a PCP. I remember for a long time before I even had health insurance, you guys were my yearly exam. Like
Yeah.
that was, I
Yeah.
felt like at least I know all of the important things I need to take care of can get taken care of at the Midwife Center. And they take my blood pressure too. Like it was just,
Mhm.
this
Yeah.
this sense of trying to find these touch points. And when I look at the challenges that we're facing in the healthcare landscape, it is scary. Hello, Freudian
Mhm.
slip there. Can you talk about what you're seeing as some of the biggest challenges facing the people that come in for midwifery support and care right now?
Yeah, I mean, I think in our country, access is such an issue. It's so hard for
Yeah.
so many people. Like you talked about, right? Like health insurance is costly. It's not always accessible. Um, we're one of the only countries where health insurance is tied to our jobs. And so
Hmm.
when you have fluctuations in your job or your living or any of those things, it's this fear of not having insurance or access to healthcare is like really there. And I think another thing that's really complicated, what we see is like how we're paid, how maternity care is reimbursed in this country is really
Hmm.
complicated. Um, and so for health insurers or hospitals, you know, we the birth isn't really a moneymaker, right?
Right.
And so when we work within an industry that is cost driven, that is financially driven, you see these closures of hospital units and places where, um, folks get their care, right? And for many people in their childbearing years, midwives, OBGYNs are their primary care providers. It's so
Yeah.
true. And so we're seeing across the country these labor and delivery units close, which means people have to travel further for care, which we know that there's a correlation between
Hmm.
distance to care and outcomes. We know that those folks have worse outcomes. And so, it's lucky Pennsylvania has a lot of attention to it. We are paying attention to it, but we are still seeing units close pretty frequently here in even urban areas where access can be limited by poor transportation, poor infrastructure, those kinds of things for people. And so, we've really lost that sort of like in community birth,
Yeah.
in community care, where you live, where you thrive, people who understand your circumstances. We've sort of lost that in our country where your primary care provider picked up their bag and came to your home and your midwife was somebody that you knew throughout the community who did your births and your sister's births and your cousin's births and those things.
Hmm.
And that just really doesn't exist for most people
Right.
in our country anymore.
So let's zoom out a little bit more then, because we're talking a little bit about demographics and, of course,
Mhm,
economics then plays into all of that. We touched on the reality that, we're seeing less people have insurance, which is also impacting care. How does race play into this? Because I know Pennsylvania, I mean, it's been very much under a microscope in terms of maternal morbidity and existing as a Black person and how
mhm.
that ties to worse outcomes. Can you speak a little bit to that and how the Midwife Center is working to combat those issues?
Yeah, I think what we know in the United States is our outcomes overall are really poor for maternal health care across all races, but unfortunately, our, um, you know, people who are in the global majority have worse
Mhm,
outcomes, especially Black, Hispanic, and our indigenous folks. And Black people suffer at 3 to 4 times the maternal morbidity and mortality than their white counterparts. And that is regardless of education, location, income, uh, those factors that are traditionally protective in social determinants of health don't happen in that.
mhm,
And what we know is that, as a result of long-term systemic racism within the
mhm,
healthcare system, and the treatment that and the weathering that Black individuals and families face in our country as they uh, work to thrive in our country. And so, and it's working within the system to, tackle implicit bias of healthcare
mhm,
workers, how we are educated, how we care for people, and working away from um, equality to, to equity, and how do we care for people and meet them where they are. And so, I think the midwifery model of care is sort of unique in that way to sort of assist that because of
mhm,
how I described our model, right? We don't just look at one part, right? I don't think of pregnancy as an illness. I wanna know, like, how's your family support? Are you eating enough food? Do you have enough clothing? How are we gonna transition? What's your postpartum gonna look like? Do you have time off? Do you have somebody who could cook you a lasagna? If you don't have time off, how can we work with your employer to get you off? What are we gonna do with the other kiddos while you're recovering and having, a baby? And so it's that looking at someone as a whole person that knows that every part of it, your mental health, your everything, how you can thrive and live and find joy in
mhm.
becoming a parent and growing your family is so important, and so many people in our country don't have that. And so I think that's where we see birth centers and midwives, and I think there's a misunderstanding culturally about where midwives are, right? Like, I do practice in a community setting. I love out of hospital birth. I'm so grateful that there's 400 birth centers in the country and that we get to do this opportunity, but 99% of midwives work within a hospital system.
Mhm.
So many people don't even know that they have access or could have access to midwifery care. Um, and most people, we can keep growing and we can be impactful. And we know that the midwifery model not only improves outcomes, but it's also a cost savings. We know that we're the only industrialized country that doesn't have midwives as their primary model for maternity care,
Wow.
and their outcomes are much better. And so we're ready. We want to help. We are growing midwives, um, and I have to be honest. We are very lucky in Pittsburgh. We have
Yeah.
amazing midwifery groups in the hospital setting. We have amazing obstetrics, obstetricians and gynecologists who support our work and collaborate with us, and hospital systems and insurers who have welcomed us in and make sure that we can provide the care we want to provide. But we want every city, every community to have that opportunity.
Oh, absolutely. And I'm really glad that you touched on something that I think flies under the radar because when we think of birthing care, I think people say it's over as soon as the baby's out,
Mhm.
basically. And we know that's not true and that we also as a nation don't really have much of postpartum care at
Mm-mm.
all. We don't seem to elevate that to the level of support that it needs to be. And that's reflected in the fact that we don't have a national paid leave policy.
Mhm.
To your point, can you talk a little bit about when you're working with birthing people about what that postpartum journey needs to look like? And I say needs in the sense of what is ideal for someone if they want to be able to truly heal after giving
Yeah.
birth?
Yeah, I mean, I think it's what I think an ideal is. It's so hard, right? Because we do
Mhm.
the absolute bare minimum here, right? Like,
Listen.
so most people might get 6 weeks off, some people 12. In other countries, people get entire years off
Yep.
with, like, in-home support and some in-home nursing support and some lactation support. I think we are doing some better at acknowledging it with, like, the postpartum extension of Medicaid for up to a year, like, that's huge, right? Like, 6 weeks is nothing, and when
No.
folks lose their insurance that quickly, it leaves open opportunities for missing really significant cardiovascular incidents, really significant healing, anemia, not helping people be successful with breastfeeding. It just and the other one is mental health, right? Like
Yeah.
we know that that time of postpartum, which is a year, we define it now as a year, um, and midwives have pretty much always done that, but like you're in the experiences of becoming a parent and, like, that transition is so huge, and so for individuals who suffer from mental health disorders pre-pregnancy, we know they're at higher risk, and individuals new things are hard, and we
Yeah.
don't provide any support, and so it's things like that we see at the Midwife Center, so, like, since 2017, we've incorporated behavioral health into our services, we have a behavioral health and wellness therapist, we do a postpartum support group that has been hugely successful. And it's just ways to like connect people. And again, I think it's back to like building community and knowing that you're not alone and hearing that you have support. And we've recently started a fathers and partners support group that's been really, really amazing. And so just acknowledging that like this is experience is bigger than that maybe 12 to 24 hours when the baby like comes out of your body, you know?
Mhm. Mhm.
And so I think these kind of efforts are what we really need to like help support families and really transition them well.
If you're just joining us, I'm Natalie Benson-Vanga, and I'm chatting with Emily McGahey. She is the clinical director at the Midwife Center. We're talking about the impact that midwifery has had in the region and really just the state of maternal and infant health around the country. And, there's been a lot of changes that have happened at the federal level, too. We've seen reduced federal capacity through the gutting of the CDC divisions that have focused on maternal and infant health, funding cuts for services, impacts on coverage,
Mhm.
including reversal of policies that protect Medicaid, and that this can all lead to significant risks both before, during, and after pregnancy. With your patients, what are you hearing as some of the concerns of the moment?
Yeah, I think folks are just, again, really concerned about access, right? They want to be
Mm,
able to see their provider in a timely manner that's not going to break their family, right? I think access to contraception has been tricky and hard for folks and the uncertainty of where they can access that.
mm,
And so we've been very lucky at the Midwife Center that we've been able to continue to do all of our gynecologic care and those kinds of things. But it's really been from support of our community. Um, and so I think, and of course, just it's just access. Like if people
yeah.
are fearful of coming to healthcare providers or
Hmm.
don't have the money to pay for it, lose their insurance, high deductibles, and Medicaid is a huge portion pays for huge portions of births
Yeah.
in our country, and the concern and I think what I just mentioned about that postpartum year, that extension that many states added on to, like, go from that 6 weeks to, the full year, I think a lot of states are concerned that the money that I think and those of us, we worry that that will go away quickly since it's more of a new addition. And I really worry about the long-term healthcare implications for those families if we lose that Medicaid extension.
Let's talk a little bit about community building and shift the conversation in a way that focuses on hope, because I know there are a lot of challenges. We've just discussed them, and I wanted to make sure we acknowledged them in the context of the moment. But I think what is so powerful about the Midwife Center is the ability to create community, and what a beautiful thing that is. Can you talk a little bit about this 10,000 baby? Because talk about a big community. I mean, when
Mhm.
when I got you guys reached out to me, and like I said, I've connected with the Midwife Center for many years in many ways. And when you reached out and you said we're about to hit this milestone of 10,000 births, could you maybe do a shout out for us? And I was like, we'll do one better. Let's do a conversation, because
Aw.
this is just so important that we acknowledge the longevity of
Mhm.
midwifery in Pittsburgh, but
Yes.
also the incredible impact that you've made on generations of people. So can you talk a
Mhm.
little bit about this moment that's coming?
Yeah, I mean, I think that I feel so lucky to be here to celebrate this with, the city of Pittsburgh, the Midwife Center, because it is a true testament to the community. I think about all of the midwives who worked here at the Midwife Center and helped foster in these amazing outcomes and these babies that were born with the Midwife Center. And, I know that like I would not be here. I stand on the shoulders of such
Mhm.
powerhouse uh, midwives who worked to do this kind of work in a setting that doesn't always support the work that we do. And I think back to all of these families, all of these people who chose to put their trust in the midwifery model and looked for something slightly different and wanted this care. And um and I think that that to me is just such a transformative moment and acknowledgement of the awesomeness of when you do something that elevates people, builds trust, builds community, and that people keep coming back. And we see folks who now are like, I was born at the Midwife Center and now I'm having my baby with the Midwife Center. And just that like impact of like how even if you can transform, there's always like a saying that peace on earth begins at birth. People say that,
Mhm.
right? So like how do we foster love and kindness and joy and safety um, in this moment that could be scary and hard but like I just feel like we are so lucky that the Pittsburgh community, these fierce advocates have fought for this place to work, um, you know, for 24 years and, for, I'm sorry,
That's okay.
44 years, uh,
That's even
to
better.
be this place that, um, people can continue to come and receive this unique care and this, um, joy that we have.
What have you learned from the people that you've worked with and the birthing people that you've supported?
Yeah, I think, I have been so incredibly humbled and, um, as a human in this work, and I've learned how the strength of an individual, um, can be lifted up by community and that presence and that support, and that when we as individuals believe in each other, that people can really do such incredible things. And I think of that in not only like watching a human grow a new life and birth their new life into the world, with hopefully love and joy and peace and feeling empowered in that moment, but also all of the individuals that I've worked with and have been part of this journey for the Midwife Center for 44 years that believed that the impact we make is worth it. And the
Mhm.
hard struggles and the commitment to keeping the doors open at the Midwife Center and to keeping this opportunity for families for generations is just incredible. And I think for me, it's just shown the perseverance of spirit and that like goodness does breed more goodness and that's what we deserve. Yeah.
That's beautiful. When we zoom out, Emily, and we look at sort of the nation and the way in which, to our conversation points earlier, we sort of dismiss this experience, we diminish it, we
Hmm.
don't provide for it, right? What do you
Hmm.
want the powers that be, and not just who's in power, but that idea of the powers that be? What do you want them to understand about investing in birthing people and the future through policies like healthcare for all and
Hmm.
paid leave and these things that would actually improve your determinants for longevity and a healthful life?
Yeah, I think it's so important, and we studies have shown that, right? Like quality care for people who identify as mothers, right? Like that they drive healthcare decisions for their family. Like
Yeah.
that those are the folks that have it. And I've said this in other places, but like no one deserves like your ability to thrive as a human, as a family shouldn't depend on the community you live in, right? Like we
Right.
as should see ourselves as a huge community that and every individual deserves high quality healthcare, ability to access food, ability to survive and thrive in parenting,
Mhm.
and like be healthy from it, right? And not have long-term impacts because of lack of care, lack of access. And so I think for me, knowing that like we know that like health of a human starts from their cellular development in
That's right.
utero, like, right? It happens from the beginning and how we continue to grow generations of healthy, thriving people. I think the impact is there that we can
Yeah.
and that there's no health without women's health and that we just have to, uh, prioritize research and funding and, advocacy towards, the folks that need it the most.
Amen to that. So, as we're celebrating the upcoming birth, the
Mhm.
10,000th birth, which you were telling me it's going to happen probably in early March, mid
Yeah, we
March.
think, like, early mid-March, yeah, we
I,
think,
I
yeah.
definitely want, if you guys could send me an update of the
We
day,
will,
because I
for
want to
sure.
post like a little story because that's
Yeah, we will.
awesome. Can you share with people if they want to support the work of the Midwife Center, how can they do that to help celebrate this exciting moment?
Thank you, Natalie. Right. So, yeah, we are an independent nonprofit. So, we are always grateful for our community that supports us. We have wonderful foundation support in the Pittsburgh community, as well as individual folks who are always constantly making sure that we can provide the care that we want to give. And to celebrate our 10,000th baby, we are trying to raise $10,000. And there's an ability you can do that on our website. And Natalie said that she was going to be fine to share our little link. And
Hmm.
so even a dollar goes towards high quality
Hmm.
healthcare and helping people have access to our care. And so, yeah, if we can do $10,000 for our 10,000th baby, we're going to be super excited.
That would be awesome. I'm gonna help you get there. I'm gonna post the link and hopefully
Thanks,
we can get
Natalie.
you some money your way because the work that you guys do is really impactful. And
Thank
I'm
you.
just so grateful to live in a city that is working towards finding solutions to some of these
Same,
systemic issues. It's a
same.
wonderful thing.
Yeah.
Anything else that you'd like to share, or is there anywhere that people can find the Midwife Center online on social media?
Yeah, so you can find us on social media. We have a Facebook, we have an Instagram. Our website is midwifecenter.org, and you can see videos and pictures of the Midwife Center. And we are just so grateful that people want to hear about us, and we are always available. And you can find us and find me, and if you want to hear more about midwifery.
All right. Thank you so much, Emily, for joining me in conversation tonight and for everyone that
Yeah.
joined us. Appreciate you all. And as always, everyone, until next time, please take care of yourselves and each other. Have a great night. Thanks, Emily.
Bye.